Rajya Sabha MP Sanajaoba has highlighted the need for establishment of Aiims or similar institutions in all northeastern states except Assam, so that patients from rural northeast states can have access to quality health care, especially while seeking treatment for cancer. Speaking to Rajya Sabha today, MP Sanajaoba sought answers from Union Health Ministry regarding plans on establishment of Aiims or similar institutions in all northeastern states. In reply, Union Health Minister J.P. Nadda maintained that in the past 10 years, 12 medical colleges, including the Churachandpur Medical College, have been developed in northeast region, and a total of 2,737 crore rupees have been spent for these medical colleges. Informed that Churachandpur Medical College has been given 325 crore rupees so far. Union Minister J.P. Nadda also informed that RIMS has been provided 4,723 crore rupees for upgradation, strengthening of infrastructure, and training of manpower. Responding about cancer treatment, Union Health Minister J.P. Nadda said RIMS will be equipped for treatment of cancer in the state, while citing that Lancet report, which stated that cancer treatments starts within 1 month from the time of detection in India.
Cancer and other rare diseases are very rampant in northeast states, especially in rural areas, whereas the healthcare facilities there are very limited, so the poor patients have to move to other cities like Guwahati, Delhi, Mumbai, etc. Therefore, there is urgent need for establishing of Aiims or similar institute in each state of northeast except Assam. My question to the Honorable Minister through you, sir, is whether the government has any plan for the establishment of Aiims or similar institute in the region to improve the healthcare facilities of northeast people.
Under the National Health Mission, there are 12 medical colleges in the past 10 years which have been given to the Northeast region. And total of 2,737 crores have been spent for these medical colleges. Churachandpur, that is in Manipur, 325 crores have been given as far as the establishment of medical college is concerned. Another thing I would like to say that we have gone for upgradation also. For Manipur, for the Honourable Member, I would like to share that the Regional Institute of Medical Sciences has been given 4,723 crores. So all this, and this has been done for the strengthening of the infrastructure as well as training of the manpower. So we can understand that it includes the treatment of cancer also.